difficult for me.
Oh, I'm sorry.
Yeah.
Um, is there any question I can answer for you, Alicia?
Yes, I have a few questions. In fact, about my situation, it's not a medical advice question, but could LDN increase anxiety if it was already present?
Absolutely.
Yeah.
So that I wrote that, and then I'll post it again yesterday. The video and the transcript and the blog all talk about that. And what happens, I think, is that it's just a matter of endorphin depletion, and the endorphin depletion is a phenomenon, and then how your body reacts to it is all different. So, for example, if the endorphin, the person had pain, um, and the endorphin depletion will probably result in the person feeling a lot of pain. If the person already had anxiety and the endorphin was one of the mechanisms by which the anxiety was held at bay, because I think the body will use everything. Our body is so resilient that if you have excess serotonin, it's going to use that. If you have excess dopamine, it's going to use that. Because really, if you are really happy, it's hard to be anxious at that moment. Do you
Yeah.
agree? If you're
Yes.
really feeling very happy or very, very rewarded, focusing on something, or you got something done, or your favorite person comes and says that that person loves you, at that moment it's hard to feel anxiety. So we can feel anxiety just at that moment. And what happens, I think, is that when the LDN dose is too high, the the what happens is that we feel anxious. We can feel anxious. Some people. How about a general word like emotional distress? Because emotional distress can be anxiety, it can be depression. So for me, even though I have both, because of the ketosis has taken a lot of the anxiety, what's now happening is that underlying depression is coming out more because the ketosis is anti-anxiety, and by having that on board, it helped me to understand what life looks like without anxiety. But because of underlying like childhood issues I've gone through, I realized that I am prone to depression and also genetics. So
Yeah.
now I'm taking like methylene blue to supercharge my um, serotonin system, and I'm taking LDN. Now I understand why I have to take LDN. It's not just for my neuropathy; it's to
Yeah.
supercharge my endorphin system. And then I've begun exercising. I've been doing basic karate kicks that I used to do when I was a kid. So I'm understanding that this is a full time job.
It is. It is.
It's a full time job.
It's particular because my pain has improved very
Mhm,
much. My
mhm,
neuropathy since 2 weeks into LDN at zero point 0.5.
mhm,
But then when I increased to 0.75,
mhm,
I
mhm.
started to notice more. It's like a physical anxiety, like high
Yeah.
heart rate, really hypersensitive to sounds, like CFS-like symptom. That's why last time I asked that question.
Yeah.
So
It's very
is the dosage for pain different than from
correct, correct,
anxiety? So it may
correct.
be that I already reached a good dose for pain, but I'm not yet there for the fatigue, anxiety, central nervous system regulation.
So that's a whole different thinking. Let me
Okay.
see if I can find something that's useful for you, okay?
Yeah. Thank you.
Because the pain is actually very easy. The issue with chronic fatigue is not it's the opposite of pain for me. For some people, pain is really hard. For me, pain is really easy. The fatigue is very difficult because multiple things can cause fatigue, and because multiple things are causing fatigue, um, I sent you on the right side. I put the understanding CFS-ME diagnosis through SHINE approach. The SHINE approach is about sleep, hormone, um, and infectious diseases that are hiding, and then nutrition and endocrine slash autoimmune. And LDN is really helpful for that, but it's just the beginning. So I think you may, I think you're an engineer, no?
Yeah. Yeah.
Because just the way you talk, the way you organize information, the way you're logical about problem solving, really reminds me of engineering approach. So you have to look at it as three categories. One is LDN is necessary and is sufficient to create changes. So for the neuropathy, as long as you're taking the right dose, LDN is sufficient, necessary and sufficient to solve that problem. For chronic fatigue, I think that LDN is, in my opinion, in my practice, LDN is necessary but not sufficient. Meaning that some people LDN is enough, but some people LDN alone is not. It's just the beginning of the journey. So, what? Let me see if I can give you another tool that is interesting. Let me see. LDN, CFS, uh, and put Yoon Han Kim. And yeah, I think I have. So this is a very useful video. And the title of the video, for people who are not here, is going to be LDN and chronic fatigue syndrome. I mean, very, very um, descriptive. So there, I think I talk about other things that's helpful, like methylene blue, and I'm taking methylene blue, and I'm experimenting with methylene blue. And my idea is that I don't like I don't I prefer I have few tools that I really understand how to get everything out of it. So the first was LDN that took 20 years, and now it's methylene blue for about 2 years. So now, but I have patients with it who are doing fantastic, fantastic, define fantastic. So this person is a healthcare professional, and before I met this person, the person had a lot of pain and a lot of fatigue. Can you relate to that, Alicio? A lot of pain and a lot of fatigue. So we did the LDN that solved the pain issue, but not fatigue issue. So I used the methylene blue, and the reason methylene blue is helpful, they say, is because methylene blue has some mitochondria, um, mitochondria like stimulating, uh, uh, resetting ways. So that, and the higher doses, it also takes care of um, the issues that people have with hidden infection. So if you have a tool that can supercharge mitochondria, and then you have another the same tool at higher doses can supercharge, I mean, your ability to fight infection. Plus, LDN also is excellent for optimizing your immune system. Then I would say that you have a lot of tools that you have that people didn't have. So that's kind of my approach is that, and then there are a whole bunch of other things that they have for treating chronic fatigue in terms of getting the mitochondria optimized. And let me see if I can find my own article on that. And let's see. And if you search for it, they all have ideas that what they have and whatnot. And the in mine, I talk about different. I think part three talks about different things. Let me see if I can access part 3 in direct integrative care. And that is the reason why um, I've gone to the new site, because it's really clunky for me to look for things in the current thing. And you know how sometimes looking for things takes a lot of time through information. And the new site is very easy, whereas the old site is it's not very fun to go through it. Actually, there's a shortcut, but my readers can't do it, so that's why I don't like it. I like the new website much better because of that.
Yeah.
Let me find that article. Let's go to select site, and then and it doesn't make sense because in the back door you can search, but front door you can't search, and it's in my opinion, I don't have kind words for that kind of thinking. Mitochondria. Okay, Dr. Kim's approach. I found it. But the other one's a lot easier. So and it's easy for everyone, not just me. That's why I like the ifmsynergy.com, and that's where I'm writing all the new ones, and some of the old ones I'll bring it over. So just go through all these things,
Yeah.
and it'll have some answers about what you say. Methylene blue, I think, is really fantastic. It's dose dependent. So in low doses, I think that um, it supercharges the mitochondria, so the fatigue gets better. Um, and then in higher doses, you get two benefits. One is microbial. The other one is serotonin supercharging. The only problem with methylene blue is that if someone is taking SSRIs or MAO inhibitors, which no one almost does, though, everyone is on SSRIs. So if you're on SSRIs, sometimes people give you warning that you can get into serotonin syndrome. But then when you look at the data and see where the serotonin syndrome happens, it's much higher dose than what I recommend people.
Was intravenous also, I think. It was also intravenous.
Yes, correct.
Intravenous, yeah. I saw that study, yeah.
Yeah. Alicio, I'm so impressed with you.
I'm very good at studying stuff, and since it's my own health, I have to study a lot.
And that's what I love working with people who are like you, who
Yeah.
um,
I also have methylene blue at home, and I have used it in the past. Now, not so much, because it's really difficult to choose the right tool if you don't have the doctor that knows about the stuff. So, you know,
yeah. So that's that is something I think is helpful, and I find it helpful. And methylene blue is a potent reversible MAOA inhibitor, and 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 basically they're saying the risk begins at 1 milligram per kilogram IV, like you said. But they're saying that sometimes it can happen even lower doses. So I think safety is don't use it. And then I just use methylene blue. And the highest dose of methylene blue is very high. I mean, people have done hundreds of milligrams and people have not gotten in trouble. And we know population wise that they've used this in World War II in American soldiers in Pacific theater, and nothing has come out. So and they're talking about doses about IV 1 milligram or 2 milligram for kilogram. So even 100 milligram, no problem. If on 100 kilogram person, and if the person is about 80, I think still 100 milligram, no problem. And that's IV. So IV is different than PO, because you're not going to like. I know that because if you take enough of the methylene blue, probably about 10 to 20 milligrams 2 to 3 times a day, your pee becomes blue,
yeah.
so that
Yeah.
you know that I'm not absorbing all of it. It's coming through the kidneys. And I have some idea that if it helps with, I just don't have data, but I think that if it supercharges my kidney mitochondria, I think that's a good thing.
Yeah. And
Because
is it true that if you pee out, blue, it means that you have taken enough. I mean, that like you said, you don't use it all of the dose, so maybe you can drop it. Is it true?
Um,
This
I think that symptom you have to follow the symptom, and
okay,
what I found is that methylene blue supercharges my nervous system, and that's what I really love about it. The
okay,
fact that my nervous system is supercharged, I really like that, and and I can tell because what happens is that it's not the anxiety that gets me. I mean, still get anxiety when I have issues, or sometimes people with anxiety, we have heightened sense of awareness, so that things that we shouldn't really be anxious about. It's almost like our mind is looking for a reason to be anxious. So that's an issue I'm still working on, and that is really great with prayer for me, and meditation and breathing works really well. Um, and and then I just say that, hey, most of the things I worry about never come to picture. Um, or writing things down is helpful. I also use AI to program the AI to be my mindfulness teacher or coach. So I will write down the situation, and you know that when you start writing things down, you calm down also. And then the Cloud Pro will spot issues for me and say, let's look at it from various places. And then I have two agents that I trained with Grok that is not as good as Claude, unfortunately. They're nicer to talk to. Claude is nicer to type to, but at the end of the day, I'm looking for information, and typing actually calming. It's got when I write down my own situation, it's calming. So I use it. I mean, I use AI, and I'm very interested in developing AI agents and using stacking agents to see how much they can help me. I never think that it's going to replace people. When you need people, you need people.
yeah,
But you know, but if there are things that AI can do for me, then I use it a lot
yeah,
for
it's
that
very
reason.
cool. You are more into AI than me.
Well, it's just before I didn't have such a need, but now I have great need. So it's all, I think, needs based.
Yes, yes, yes. So nobody's joining, so I think
No, it's not nobody. It's just two of us. So I think that's
okay.
we answered
Okay.
that question. And you know what I found out, Alicia?
Yeah.
I'm going to stop the recording
Yes.
and